Okay, so here I'm showing the male urethral sling. This is the Advanced XP made by Boston Scientific. It's the most common sling used in the US for mild stress urinary incontinence in men. Here you can see an anatomy diagram with the urethra to the bladder. Typically this is done in men who have already had their prostate removed. That's why you don't see any prostate in this diagram. And this blue circle shows you where the sling goes. And this zoomed in focus here shows you the sling when it's in place before it's tightened. And then this second photo here shows you when the sling is tightened, it pulls the urethra to help prevent it from moving when the patient coughs or sneezes or increases their abdominal pressure. Now, the advantage of the sling is that the patient doesn't have to push any buttons. The sling just works on its own. So it's a pretty interesting device, and I'll show you here what the sling looks like. This is a synthetic material that comes out of the box like this with these sort of protectors on it, and it has these sort of fine ridges on it. I'm not sure how well that's coming into resolution, but these ridges basically help prevent it from moving. So we don't actually, we put some stitches in the sling right at the urethra just to help prevent it from sliding out of the wrong position. But once we tighten it, the arms sort of keep the sling in position without us having to put any more stitches. And that's because of this sort of lock design that comes in it. So this part here, this widest part, is the part that actually touches the urethra. These arms here go through the obturator, basically the space in the pelvic muscle, pelvic bone, to support it. And so once we put it into the right position and we tighten it, then we just take the scissors and we cut this kind of outer component of it. And then here we basically, if I can pull this. Actually, you need to have some back support. You pull this outer sheath out, and then this just goes in the trash here. And then this component here is the part that holds the pressure. You can see those fine ridges on there help it from moving out of position. You can see here, this is the big ridges here that really help secure it in place. And then on the other side, we do the same thing. I'll just show you again. So here we cut. Then we grab this component here and then pull this outer part out. This all goes in the trash. And then again, these locks hold it in position. We don't have to put any stitches on it. And this is it. It's very flimsy, thin material. Patient doesn't really feel that it's there. They don't have to push any buttons or interact with the sling. It's sort of working on its own 100% of the time. This is a synthetic material that does not get absorbed, so you could, in theory, go back in and take it out if you had to. A decade later, it'll still be there. Obviously, that's very difficult to do because it's locked behind the bone, but that's just to tell you that this thing is a permanent implant. And typically, once it's in, it's working right away. Unlike the artificial sphincter, the effect is pretty much immediate. So patients should notice a significant improvement in their leakage basically as soon as they wake up from surgery. So it has the advantage of being simple to place, easy for the patient to use. Disadvantage is that it doesn't really work well for severe leakage. So it's mainly indicated for mild leakage.